name is Krystin Ragsdale, and this is my week 1 skills check-off video. We'll be starting with hand washing, and it's important that you use warm water when doing so, as it works much better than cold water. You start with a couple ounces of soap, just enough to thoroughly cover your hands, and you want to rub for 20 seconds here. And that's just so that you can do an accurate job cleaning. You definitely want to get the backs of your hands on both sides, as well as up just around the wrist area. A lot of people forget about that one. Another thing is you want to get underneath your nails. Most people don't think about that. Most hospital care settings do require that you have short nails at all times. But that's something that you definitely want to check, as it can hold harmful microbes. So after that, you rinse back off with the warm water. And before cutting off the water, you want to grab your paper towels or napkins to dry your hands. You'll do that, you'll dry off your hands thoroughly, and when you're done, use the paper towel to cut off your faucet, because at this point it is contaminated because you touched it with your dirty hands to begin with. You'll throw that in the trash, and then you'll begin to don your PPE as if you're going into a contact patient's room. Now this will all be done outside of the patient's room, just to keep it from getting contaminated on the inside. So you'll open your gown, and this is one that my workplace generously allowed me to take home with me for the sole purpose of this video. And you want to open it to where you have the back of the gown facing you. So some gowns come with ties at the top. This one does not. It is a loop. But you want to press your hands through the sleeves first. Place the loop over your head. And then you want to tie the gown around your waist. And you want it tied securely so it covers as much of your clothing as possible in the back. Now, this isn't always possible, but you still want to get as much covered as you can. After you get your gown tied securely so it won't come undone, you'll start with your gloves. Now, these are nitrile gloves, which is what's used in most standard precautions. You'll take 2 of them out, and as you don your gloves, you want to ensure that it comes up and covers the cuff of your gown. And this creates a good barrier around your wrist and your hands. And you'll do this with both gloves. So let's get those on. And then you're ready to go into a contact patient's room. So at this point, you'll knock on the door, enter the room, and introduce yourself. The way I normally do it is I give them my first name. I say, "Hi, my name's Krystin. I'll be your tech today." Or in the case of this, I'd be a CNA, hopefully when I graduate this course. And then I'd ask them, if they came in and hit a call light, I'd ask them what they need, ask them if I can do anything for them. I'd get my vitals while I'm in there, just as a good time management practice. Now, when I am ready to exit the patient's room, I've done everything that I can for them while in the room. Say I'm going out to get them a beverage if that's allowed for this patient, or I'm working with the nurse going to tell them something, whether it's abnormal vitals or what have you. I'll start to exit the patient's room, and at the door, before I fully exit, I will take off my gloves. And I want to do that by gripping one glove on the inside. And that way, I'm taking it off without ever contaminating the hand that it just came off of. All right? And then I will slide my fingers underneath the cuff of the next glove so as not to touch the dirty surface, and pull it inside out while still gripping the first. And this way, both my hands are staying clean. From there, I'll grip the back of my neck and pull it loose. Whether it's tied, I can untie it, or in this case, it's just a thin gown, I tear it off. It's the easiest and fastest way to do so. And then I do the same thing at the waist. Now, as I'm taking it off, without it touching the floor or any of the surroundings, I want to turn it inside out. This keeps all the contaminated spots together, and I'll roll it up so it can be disposed of properly. My gloves are in there as well. The dirty parts of my gloves are still inside, so all I'm doing is touching the clean inside of my gown. From here, I can exit the room and dispose of this in the correct container. Usually it would be a biohazard container in a hospital setting, but since I do not have one of those in my home, it's going in the trash can. Now, my hands are not visibly soiled, but I have finished patient care, so I do need to perform hand hygiene once again. In this case, I can use an alcohol-based hand sanitizer. Now, in hospital settings, most of the time these are mounted on the wall, so you never have to touch the outside of the bottle. It helps prevent contamination. But you'll get a small amount, usually about the size of a dime or so, in your hands, and just enough to cover thoroughly, and you'll rub until your hands are completely dry, which is usually about 30 seconds or so. And this is the amount of time it takes to truly kill all the pathogens that are on your hands at that time. Now hopefully your hands are mostly clean, but good hand hygiene practice is the most important step in preventing contamination from one patient to another, as well as from one patient to yourself. You gotta think, you're gonna be using your hands for everything. So before eating, after eating, before and after toileting, you always want to use an actual soap and water method of hand washing. But whenever you are in between patient care and you do not have any visible soil on your hands, whether that be blood, fluids, whatever you come into contact with, you definitely can use alcohol-based hand sanitizer at that point. All right, and that is my skills video for week 1. Thank you so much.